Welcome to our first ever video format training session. Hopefully this will allow everybody to have access to this wealth of knowledge. And speaking of wealth of knowledge, I'd like to introduce Kirby Fraley, which I'm still having trouble saying, Kirby Fraley. Would you please share all of the initials that go after your name and explain?
Okay. So the letters behind my name are MA, LBA, and BCBA, and that's a lot of letters that are basically all mean the same thing. I have a master's in clinical psychology, and I'm a licensed board-certified behavior analyst.
So what we would like to discuss this round is how to effectively reach and teach our special needs population, and how to go about that in the best ways. I want to start by asking you, who is traditionally under that umbrella of special needs?
Generally when we're in like an educational setting or medical or therapeutic setting, usually when we refer to something like special needs, we probably mean somebody who has been diagnosed with a developmental disability, a physical disability, learning disability, or maybe a behavioral disorder, something kind of in that realm.
So that is a broad range of situations.
Mm-hmm.
And then on top of that, we're not going to always know diagnoses. The parents may not even have official diagnosis. So what do we do then when we don't know that official diagnosis?
Well, I think especially in a church environment, we don't always have that information. Like you said, sometimes the parents may not even know. It's possible they don't even know their child may need some kind of evaluation for a diagnosis. Or that may just be information the parent chooses not to share with church volunteers.
Sure.
And that is totally within their rights to do that. It's private information and they may not feel comfortable sharing it. And quite frankly, it's not necessarily our business when we're in these doors. So the nice thing is, though, if you kind of know a few things about some of these disabilities, some of these possible diagnoses, and you start to see signs of that in a kiddo who's really kind of struggling to participate in church the way that we would like for them to, we can kind of assume that there may be something going on and approach accordingly.
So what do I do with the idea that may feel it might feel unfair or insulting to assume that a child has special needs?
Yeah, and I get what you mean. I mean, you kind of go, why would I assume someone has a disability? What if they don't? That's a fair question, but the biggest point is you're not going to tell that child, I think you have a diagnosis. You're not going to tell anyone else that you think something is going on. It's just internally you kind of recognize this child may have some social deficits, or this child may have some attentional issues. And when we think that way, we can approach accordingly. And the fact is, when you're using the same skills that would be helpful to a child with ADHD, autism, anything like that, those won't be harmful to a child who's typically developing and may not have those issues. So really, there's nothing offensive about it. It's just helpful ways to approach the situation.
So after it's all said and done, it basically just means that I'm treating this child with more understanding and patience.
Exactly.
Okay. So let's talk about some of the official diagnoses.
Okay. So some of the things you might be likely to encounter in the church environment and just in life. One of the first ones I'd like to talk about is my particular area of expertise. I work mostly with children with autism, and I'm going to kind of include sensory processing disorders in this conversation because there's some overlap there. So generally, kiddos with autism are going to struggle socially with their peers. They may even struggle to communicate wants and needs to adults. They may vary on their level of ability to communicate vocally. Some are very verbal, some may be completely nonverbal, some just fall somewhere in the middle. So you may be looking at some sort of speech delay. They may have a sensitivity to bright lights, sounds. That also goes for sensory processing disorders. They may be very sensitive to physical touch. So some of the things we want to consider when we're approaching children who may or may not be on the autism spectrum or have sensory processing disorders, we want to consider things like we're going to avoid casual touch unless we know that child is comfortable with hugs, high fives, things like that. And on the flip side, some children on the spectrum actually are overly affectionate and sometimes struggle with knowing what the boundaries are with adults outside of their families or with their peers. They may give unwanted hugs, kisses, things like that. And so we want to be really straightforward. Honesty is always a great thing with autism, being very straightforward, very honest with them. This is a boundary. That's my body. That's my space. Give me a high five instead. So I'm going to correct the violation of a physical boundary. And then I'm immediately going to give them instructions on how to appropriately show me affection.
Okay.
Another thing you want to consider when it comes to like bright lights or loud noises, some kiddos may be sensitive to that. And in those cases, we want to recognize that sometimes, especially on Wednesday nights in big group, things might get pretty loud. And that can be stressful for some kiddos with autism or sensory issues. So in those cases, we want to be sure that they have access to a break, that they can leave that loud or bright or overwhelming situation and just take some quiet space for a few minutes.
How can I tell that a child might be having a hard time in that situation?
So sometimes, you'll see a child actually covering their ears or covering their eyes, and they may very well communicate to you, like, this is too loud. You might also just see things like a lot of rocking, spinning, jumping, flapping. That hand flapping behavior is really common in autism. When we see things like that, it could be that the child is very excited. It can also be that they're getting overstimulated. And the biggest thing there is just to check in with that child and ask, do you need to take a break? We can take a walk for 1 minute and come right back. Just offering them that option. Another good option when it comes to loud situations, because obviously sometimes church is going to be kind of loud and overwhelming, maybe the whole hour, right? So in that case, even having headphones just on standby for any kiddos who need it, just to dull the noise and make it a little less overwhelming, is a great way to help a child who's having some sensory issues participate fully in church. Something else we want to recognize, again, I want to go back to the honesty thing. We want to avoid using sarcasm with kiddos who may be on the autism spectrum.
Okay.
That's one of those things that's a very subtle way of speaking, and there's a lot that's left unsaid. We might say something like, oh, great job, glad you're doing that. But that to a person with autism sounds like, great job, glad you're doing that. And so that's not going to have a lot of meaning for them. So we want to be very straightforward. We want to be clear with our instructions, and we want to avoid sarcasm. And kind of piggybacking off of that, we want to be sure we always use do statements. So a lot of times in our way of speaking to kids, we might say something like, can everybody come sit down? Or will you go right on the board for me, right? We give instructions in question form, but we actually mean do this thing that I'm telling you to do. But the fact is, if you say, can you come sit down? Or will you come sit down? Again, for a very literal person, like someone who's on the autism spectrum, a fair answer to that question can be no. They're just answering your question.
I think it's options.
Right. You're giving them an option if you're asking them a question. So we want to be sure to phrase our instructions in the form of statements. Come sit down. Go to the board. All of those things are very important, and it may seem subtle, but to them it's not. That's a huge difference. Now, I sometimes make the mistake of giving an instruction in question form, because again, sometimes that's just the way that we talk.
Yeah. Politeness.
Exactly. If I realize I've made that mistake because a kiddo tells me no, then I'm going to say, okay, 1 more minute. That way I'm honoring the fact that they said no. They were using their words. They answered my question appropriately. And then I'll say 1 more minute. And then after that minute has passed, I'm going to give the instruction again in statement form. Okay, so that kind of covers a good bit of the autism and sensory processing issues that you might encounter here.
Let me ask you something else on that, though.
Go for it.
Spectrum is a term that is, often used. Elaborate just briefly on what both ends look like. The idea of spectrum implies that there's a wide range of, autism situations. So how do we recognize either end?
Yeah. So when it comes to autism, when we talk about the spectrum, generally the kind of diagnostic side of that is we're looking at low functioning to high functioning. That's typically how we're diagnosing based on severity of symptoms. And usually on the more low functioning end of the spectrum, you might see kiddos who are not communicating vocally. They may be entirely nonverbal, so they're not even able to communicate using picture exchange or, iPad communication devices, sign language, things like that. You may also find that on the lower end of the spectrum, you might see kids who are not toilet trained, or still struggling with toilet training, well beyond the age where typically kids are toilet trained. And then on the other end of the spectrum, you see kids who you might honestly not even realize that a high functioning child with autism, at most you're going to see some of those things that I was discussing. They might have some sensory issues. They might be extremely verbal, and they might be extremely affectionate, or they might be extremely averse to affection. It's very individual based, but we do look for things like this. And I do know that sometimes when we encounter high functioning kids on the spectrum, it's easy to kind of go, does he really have autism, or is he just kind of being a pain? And it can seem that way. It can seem sometimes like rudeness, but a lot of that comes from not being able to pick up on social cues or use social cues properly. And so what looks like a typically developing child who's just giving you a hard time is sometimes a kiddo who's just really, really struggling with understanding the world around him.
Gotcha.
Yeah.
Okay.
So let's move on to ADHD. This one is fairly common. We see a lot of kiddos, and that stands for Attention Deficit and Hyperactivity Disorder. So generally with ADHD, we're seeing kids who are very, very hyperactive, may have short attention spans, and may have difficulty sitting still for long periods of time. May have difficulty following multi-step directions. They're struggling to attend. If you tell them, like, go get your Bible, then go get a crayon, then come back and sit down, they might only get to the Bible step, right? Which a lot of kids do that, let's be honest. Multi-step directions are hard. But they might get to the Bible step and then immediately start running around the room. Yeah. And in their minds, they did follow your instruction, but they only caught the first part of it. So we have to be sensitive to that and remember that they may need multiple prompts. We may need to break down our instructions into shorter steps to help them attend to the whole thing. One thing that doesn't always get discussed when we're talking about ADHD is impulse control. That's a big one. Kids in general are not as good at controlling their impulses as adults are, and that just has to do with brain development. But kids with ADHD really, really struggle with it. It's basically like the moment an idea pops into their brain, their body is already in motion, acting out that thought before they even have time to filter it and go, wait, what are the potential consequences here? Yeah. What is this actually going to do? Is this a good idea? Is this against the rules? Is this the instruction that I was just given? So when it comes to impulse control issues, those are things that can improve with time. For some kiddos, it may improve with medication and things like that. But again, and we're going to discuss this a little more in a few minutes, but the medication side of things is not necessarily, that's another one of those things we may not be privy to, whether they're medicated or not. We don't have that information usually. And it's also not really our business. So we're not going to worry about, wow, this kid needs medication, which sometimes it can feel that way. Instead, we're going to think of ways that we can help them here practice their impulse control. And a lot of that has to do with us being able to put ourselves in their shoes and recognize how they're seeing the world and see a potential problem before it happens. We have to constantly be one step ahead. For instance, if I'm sitting next to a child who I know is struggling with impulse control issues, if I set the cup of markers down right in front of that kiddo, and he's supposed to wait, but I haven't specifically said that right then, there's a really good chance that kiddo is going to immediately grab all the markers before they even have instructions, right? So what we want to do is, in that situation, I'd want to set the can of markers outside of their reach and then immediately give an instruction. I need you to wait, hands in your lap. Give a positive instruction about what they should be doing and make sure you're just kind of ready. They're going to struggle with that impulse control, so be a little bit ahead of them on that. So another one I'd like to discuss is ODD, and that stands for Oppositional Defiant Disorder. And this is kind of an interesting one because a lot of times kiddos who are struggling with oppositional defiant behavior, they just look like kids who want to do the exact opposite of what you just told them to do. And it is extremely frustrating as the adult in charge to deal with this, but you have to remember that children who have this disorder genuinely they kind of can't control it. It really is. They can learn to control it with practice, but we have to remember that that's not really their natural state. The thing that's most reinforcing to them is not necessarily your praise or approval,
right,
which some kids seek out, right? Instead, these kiddos are actually seeking out reprimands. They're seeking out negative attention. And so when we give them that negative attention, when we spend a lot of our time chastising them, reprimanding them, maybe raising our voices at them, drawing attention to their undesirable behavior, we're actually reinforcing that, and they want to do it more and more. So we have to consider that. If we've got a kiddo that's engaging in high levels of oppositional behavior, we want to practice what we call active ignoring. So when I say active ignoring, that sounds a little bit like an oxymoron, but what that basically means, the reason we like to use the word active in front of it is if I'm actually ignoring something, I'm truly blocking them out, don't care what's going on over here. But when we're in charge of kiddos and their safety, we can't actually fully ignore them. So when we say active ignoring, it's very intentional. I'm watching this child out of my periphery because I want to make sure that they're not getting hurt, that they're not doing something dangerous, that they're not endangering the lives of other kiddos here. We want to be aware of what they're doing, but I'm not going to make eye contact. I'm not going to speak to them. I'm not going to touch them, physically redirect them. I'm not going to give them any kind of attention, even a reprimand, even an eye roll, or giving them the, like the mom glare, that kind of the parent look that we might give when we're frustrated. Even that's attention. It's reinforcing. So rather than giving them attention for this undesirable behavior, I'm going to spend my time and energy drawing attention to all of their peers that are making good choices. That way, it hopefully incentivizes them. If I want to get your attention, I'm going to have to start making better choices.
That's a tough one because those are moments when I have to allow the child time to go through that process, when it's very difficult to allow that to continue.
Oh, yeah.
That takes a lot of intentionality and a lot of patience in this situation.
Yeah, it does. And a lot of times what you see is, you spend a lot of energy drawing attention to the good behavior of peers, and you really want to praise them, because it's not only that we want this kiddo over here to focus up and recognize, like, I'm only giving attention to those who are making better choices than you. But you'll also have other kiddos who are saying, so-and-so's doing that. They're kind of like, hey, do you not see what this guy's doing over here?
Yeah.
And again, rather than turning my attention to them, I'm going to tell this peer who's pointing out undesirable behavior, I'm going to say, I know, I wish he was making better choices. Thank you so much for what you're doing right now, and just continue on that same vein, and make sure you're drawing lots and lots of attention to all the good choices going on around this child.
Yeah, absolutely.
Mm-hmm. So some of the other disabilities or special needs we might encounter, vision or hearing difficulties, that seems like kind of a mild one, but think about how many kids we may encounter who haven't had a recent vision or hearing test. And those are issues where that child most likely doesn't know they need to ask someone, like, hey, I don't think I can hear things like my friends can. How would they know? As far as they know, that's a normal experience.
And that's an underlying recurring idea here.
Yeah.
That what is normal in the child's mind
Right.
may not be normal on the outside, but in that kid's mind, he or she is doing what they are supposed to be doing. And
Exactly.
I have to constantly remind myself that this child is not being rebellious in their head. It's normal.
Right. In their head, they're engaging in a pattern behavior that works for them. This is all they know. They're just responding to their environment in the best way they understand how
Right.
to. So when we have vision or hearing difficulties that may have gone undiagnosed, or maybe the child, I worked with plenty of kiddos who won't wear their glasses, won't wear their hearing aids. They're just kind of, rebelling against the devices that they need to improve those skills. But if they can't see what's going on in the front, we're likely to see they're going to get bored, first of all, because they can't really see what's going on, and we may see some behavior from that, right? They may act out a little bit because it's like, I don't know what's going on, what's everybody looking at. Or with hearing difficulties, we're assuming when we give an instruction, you heard what I said. But did they? Maybe they didn't. There are times when we have to consider it is entirely possible that child is struggling to hear the instructions given, to hear the lesson that's going on.
Sure.
And that may explain some of why they're not acting the way we prefer them to. So something else we want to consider are mood disorders. We don't usually think about things like depression and anxiety in children, right? That's something we tend to think of as like an adult problem, but it isn't. Kids experience it all the time. It's honestly sadly prevalent in children. And the interesting thing with depression and anxiety in kids is we don't always see it presenting the way we do with adults. So in adults, if an adult's depressed, they might sleep a lot, they might eat a lot or eat too little, they might cry a lot, they lose interest in things, they withdraw from people. Those things can all happen in children, but one of the top symptoms we look for in kids with depression is irritability. So if they're being rude to you, or they're talking back, or they're getting short with you for no reason, you might consider that child may be actually going through something that we don't know about. And how often does that happen, that there are things going on in that kiddo's life that we're not privy to?
And that's another recurring ongoing theme here, is that I need to constantly stop and think, to assume and to realize that there is a reason that this child is acting how they're acting.
That's right. There's always a reason. Kids, believe it or not, we don't always understand it, and they probably couldn't articulate it, but kids are never doing something just for the sake of it.
Right.
They have a reason. Even if it's not a logical one, it's there, and we just have to remember that they're really not doing things just to get under our skin. They do have a reason for behaving the way that they do.
They're not pure evil.
No, I don't believe any child is born pure evil.
Right.
I don't buy that. So the same goes for anxiety. When kiddos have anxiety, sometimes what I see happen is, for instance, like in a school setting, if a kiddo has to stay in from recess for a few minutes to finish their work and they see their friends leaving, they may raise their voice and start to sound like they're talking back a little, giving a little lip to teacher, like they're gonna go without me, and it's kind of panic symptoms, but it comes out as rude and irritable and those kinds of things. And I'm not saying that it's okay for a child to speak to their teacher like that, but we just can approach it with a little bit more compassion.
Sure.
And recognize that they're having a hard time with this current situation. They may be experiencing some anxiety. Let me use this as a teaching moment to tell them, are you feeling anxious? We can teach them to recognize their feelings. Are you nervous right now? Okay, let's take some deep breaths and talk about it. And show them a more appropriate way to communicate that with a teacher that doesn't involve raising their voice. This is when kids are learning coping skills. This is when they're learning to ask for help. And we can help teach them that.
Sure.
So another one we want to talk about is cognitive delays or intellectual disabilities. Basically, there are some kiddos, there are actually even some adults, you'd be surprised, who've never been tested with an IQ test, right? Like some people go through their entire lives not knowing officially what their IQ is, and some people may actually have cognitive delays and be functioning at a somewhat normal level, but not realize that they're struggling to understand some of the things that are happening. So, for instance, an area where this really makes a difference is when you give kids instructions and you say, "Do you understand me?"
Mm-hmm.
And they go, "Uh huh." They've learned to do that, but not all of them actually understand. They'll tell you yes because they feel like it's the right answer, but that may not actually, they may not actually understand what you're telling them.
It almost feels like you ask a person, "How's your day going?"
Yeah,
They say fine 98% of the time, even if it's not.
absolutely.
A conditioned, automatic, easy sort of response.
Yeah.
Because they don't have to explain anything. It's just, yes, yeah, sure.
Well, and if you start to notice that a child is frequently saying that they understand and then still failing to complete the instructions the way that you gave them, it may be that we need to just consider the fact that there could be a cognitive delay. Again, one that's diagnosed or undiagnosed, doesn't matter. You're not aware of it. But go ahead and start giving let's simplify our language a little bit. Let's give shorter instructions and break them down into smaller steps. Maybe that child needs a little bit more individual instruction. Maybe it's not even cognitive delays. Maybe it's an auditory processing disorder. You know, some kids hear things and it kind of goes in one ear and out the other because their brain is having trouble processing the information that was given them. And so in those cases, we want to consider that child may need a little extra instruction and may even be struggling with group instruction. This is also really true going back to ADHD. A lot of times, if I'm not saying your name specifically, you're not tuning in to what I'm saying. So if I give a group instruction, class, now we're going to do this, they may not actually tune in to what was just said. So I need to make sure that child gets an individual instruction to be sure that they clued in and heard everything that they needed to know.
And honestly, it's not asking that much to just take a couple extra seconds.
Right.
To help that child along.
Exactly.
Everybody wins.
Exactly. So another thing we want to consider are physical disabilities. Typically with physical disabilities, this is going to be a little bit different. We're usually going to be privy to this information.
Yeah.
Those are not usually quite as hidden. That might be something we can see visibly. And in that case, I would say, especially if there are safety concerns, make sure that we communicate with the caregiver about any special support or assistance that child may need. But generally speaking, kiddos with physical disabilities can do just about anything their peers can do, but we just want to make sure that they are able to participate safely in everything that we do here. So let's kind of jump back to something I touched on earlier. I want to talk a little bit about medication issues. This kind of goes in the realm of special needs because a lot of people who have a diagnosis may be on some kind of medication for that diagnosis. Again, I want to emphasize, medication is not our business. In the church setting, it's not appropriate to ask a caregiver, does this child have medication? Unless there's like a medical emergency and you need to know what's going on. Otherwise, it's not really appropriate to say, wow, this kid was really wild tonight. Did he have his medicine today, right? Those are things we want to avoid. That's very sensitive and it's private information. But that being said, we want to consider that whether or not we know whether a child is on medication, there can be a lot of issues that come with it. Medication, unfortunately, not an exact science. And
it's very experimental.
It is.
Especially early on, trying to figure out what medication is best and all the side effects and
Exactly.
all that.
Exactly. And with kids, it's probably even more experimental because we're using medications on developing brains and it's kind of hard to know how that's going to affect them. So we have to consider that if a child may or may not be on a medication, there may be side effects from that medication. It may not be the correct dosage. Like you said, they're still kind of figuring things out with their doctor. It's possible that child is over-medicated. You know, maybe, again, that dose may not be quite right. Or maybe mom gave kiddo dose in the morning and then dad came in not knowing child had already gotten their dose and we got a double dose. You'd be surprised how often that can happen sometimes. Total accident. But it does occasionally happen. And so you may have a kiddo who's behaving oddly and it could be due to medication issues. Or maybe they missed a dose. Maybe somebody forgot. Whatever the situation is, if behavior is arising out of some medication issue, it is important to remember that not only is that probably frustrating for you and maybe for their parents who are still trying to sort that out, but also it's really, the kids aren't in charge of their medical care at all.
Right.
So like in terms of talking about what is the fault of the child, or what responsibility the child carries for their behavior, this is one thing that like is really not in their hands at all. And so we just have to be sensitive to that.
Yeah. So let's then move into, that's a good segue to other things that might not be an internal thing in that child's life. What other things might also be included in what is looking like a broader definition of special needs?
Yeah. So I think it can be helpful to kind of broaden that umbrella a little bit. Like I said, what we talked about just now, that really is more of like medical definition or educational definitions of who falls into the special needs populations. But I think we can all agree there are other kids who may not have anything diagnosable going on, but man, oh man, they've got some special needs. They're needing some special care. So we need to consider, like, some kids experience homelessness. That's not something we haven't seen at Cedar Lane before. A lot of kids are experiencing hunger, real hunger, on a regular basis. And that we know, if kids are not getting enough sleep, enough food, those basic needs aren't being met consistently and well, it absolutely affects their behavior in a major, major way.
And on things like this, it is so important for us to practice empathy as much as we can and think, how do I feel if I miss lunch for an hour?
Right.
Not to make light of all this, but that whole idea of I'm hangry, I'm so hungry, I'm angry. If I miss lunch today, and a lot of these kids miss at least a meal almost every day.
Right.
And it's so important for us to think, how would I or how do I feel if I get in that situation?
Right. Which is one of the reasons Cedar Lane has made such an effort to make sure on Wednesdays the kids get fed, period. They get fed and they get fed well, and that's amazing. But we also have to consider, if they haven't eaten much in the previous part of the day and then they eat a whole bunch, that can even affect their blood sugar goes up, and that's okay. We want them to have a good meal, but it affects their behavior. Yeah. We also have to consider that some kids are they are either currently experiencing or have experienced abuse or neglect. That's a real thing that a lot of kids go through. And it's something, again, that we would not be likely to be privy to. We want to be sensitive to it, try to be aware of the signs so that we can help that child if they need it. But the fact is, we may not know what's going on, but it will absolutely affect their behavior.
Yeah.
We also want to consider that some kids may be displaced from their regular living situation. So it could just be that their family has fallen on hard times, and rather than experiencing homelessness in the way we usually think of it, they may be staying on a friend's couch, or maybe they sent their kids to stay with grandma for a little while. But either way, they're just kind of displaced from what they know. They're displaced from their routine. Some kids may be in foster care. That's a big thing because sometimes they can get kind of bounced around. It may be a new situation. That's tough. There may be some kids who have family members who are very, very ill, maybe gravely ill. They may have lost a parent or a close family member recently. They may have parents or family members who are incarcerated or deployed overseas, gone for long periods of time. There are also kids who, those are kind of some of our big, trauma, right? We think of this as definitely traumatic to a child, but the fact is, kids are sensitive. They bounce back, but they are sensitive. So things like moving to a new house. It doesn't even have to be moving cities. It could be moving to the other side of the city, so they have to change schools and all their friends are at the old school.
Even if it's a good situation.
Absolutely. You could be moving to a cooler house, with a swimming pool or something. But even then, it can still be a little bit traumatic. That's not to say if you move your child from one side of the city to the other, you're causing them trauma. But we just have to consider that in that time, they may need a little extra special attention because that's really, really tough for kids. Also, kids experiencing divorce or their parents have separated. That's a big deal. And they may have a shared custody situation where, they go to mom's house and the routine is a little more willy-nilly and kind of we go to bed when we feel like it, and then they go to dad's who's a little more, rigid about the routine, or vice versa. All those things, just trying to figure out the new normal and the new expectations in different environments, that can be really hard on a kid.
Sure.
And it can affect how they behave in other environments. We also have to consider that some kids may be having difficulties in school. That can make a huge difference, whether it's academic difficulties or maybe they're being bullied. Maybe they're having trouble socially. That's not something they're likely to share with someone they're not super duper close to. So we may not know that that's what's going on, but that can really affect their mood and just how they behave all the time. And really, I could go on with this list, but there's there's thousands of things that could affect kids in some sort of traumatic way for that child, and that can then turn around and affect how they behave here at church.
So, all of this is a lot to take in. Fact of it is, these things can cause difficulties. That is the nature of it. So I, as a volunteer, I can very easily feel discouraged if I feel like I'm not doing a good job with this stuff.
Yeah. Yeah. And, I totally get that. And part of it is because, especially these last ones we discussed here, they're completely outside of our control. And we may not even know that they're happening. And so you find yourself feeling frustrated and like you're not making a difference. And I kind of have an example of a time that I really felt this way, and not in my job, not the days where I get paid to go in and fail sometimes. But a couple of years ago, I went with Andrew to Camp Watoga. Do you want to explain what Camp Watoga is?
It is a mission trip where we take the counseling staff at a camp for a one-on-one experience. Every kid at the camp has one individual counselor who is by their side all the time, pouring into this child. And all of these kids are from Atlanta inner city. And so almost every kid here at the camp lives everything I would expect from an inner city life. Very dangerous, very scary, very different atmosphere from anything that I am accustomed to.
Right. Yeah. And I went down as a counselor, and I was assigned to a 13-year-old girl. And she was actually kind of in a unique situation. Hers was I went in expecting a kiddo who maybe lived in a place where they never felt safe falling asleep, or didn't consistently get meals, or had maybe lost someone to violence even. There's a lot of gun violence, and a lot of these kids have experienced that in some way. So I was fully prepared for those kinds of issues, and what I encountered was something totally different. This young woman was actually, her aunt brought her to the camp and was involved with the camp.
Volunteered at the camp.
Exactly. And so even though they attended this inner city church, they weren't necessarily living directly in the inner city. In fact, they had just gotten back from a vacation to the beach. So she actually was coming from a different situation than a lot of her peers there. But from day one, from the moment she got off the bus and met me,
and because of all of those different situations, you might have expected this to be an easier child.
Yeah. She wouldn't speak to me. She wanted nothing to do with me. Everything I said to her, she rolled her eyes at me. And it was very apparent very quickly that this child did not want to be there and wanted nothing to do with me, which was unique because most of the kids, this was their dream. To be at this camp for a week is a vacation from their lives that are very, very stressful. It's a safe place where someone gives them one-on-one attention for an entire week. Her aunt pulled me aside pretty quickly after I met her and let me know that she had actually just lost her mother a few months before the camp. And she didn't lose her to violence or anything like that, like a lot of these kiddos. I think she died of natural causes. I don't know exactly what the situation was, but this girl was angry. She was angry at the world, and she was experiencing grief that I've thankfully never had to experience. And she was having a tough time. She would tell me daily, regularly, that she hated me and to go away. I'd come and sit with her. My job was literally just to be with her at all times. And she would walk away from me. I would be like practically chasing her around the room, just trying to get her to allow me to sit in the vicinity of her. Another part of my job was to try to help her participate in camp activities, to encourage her to get involved and meet people.
Which is outside of your comfort zone anyway.
Absolutely it is. Anyone who knows me even somewhat well knows that just camp in general, outdoorsy activities, dodgeball, slip and slide, all that is not fun for me. But I got in there and I did it, and I acted like I was loving it because I so badly wanted to connect with this girl, to find something to connect with her on. And I would love to tell you guys that I have a really happy ending to this story, and that I came through and I inspired her and we're still best friends and keep in touch on Facebook. None of that is true. None of that is true. I left, I spent 5 days pouring my every ounce of energy into this girl. And on the last day, all the kids are crying and hugging their counselors and begging not to go. And this girl wouldn't even tell me goodbye. I mean, I was crying, but only because I was stressed out and tired and sad. But she still wanted nothing to do with me. I didn't connect with her. I don't know that I made a difference. And that was what I got in the car with the people we'd gone with and just kind of bawled my eyes out and said, I didn't make a difference. I did nothing. I put all this energy into spending an entire week with this girl. Think about that. That was almost 24 hours a day. I slept in the same cabin as her. Other than like bathroom breaks, I was with her every second of every day. And that's very different than 1 hour on Wednesday nights, right? With a bunch of kids. This was one-on-one. And I made no connection that I could see.
That you could see.
Exactly.
So, should you, in that situation, and let's talk about that word should a few minutes, should you call that a fail? Because the beauty of that camp atmosphere is that you have this one child and they are your mission.
Yeah.
But the hard part of that camp atmosphere is that you have this one child and they are your mission, which means in that situation, you could very easily let yourself feel like you completely failed. So how do I deal with that? Should you look at that experience and say, I did nothing?
I should not. Now, did I initially? Totally. Again, I got in the car and just said, I failed. I did nothing. I totally wasted a week and nothing happened, you know? But after reflecting on it a bit, I realized that that's not a failure. First of all, I showed this girl patience. I will say I do feel like I was very patient with her. She called me every name under the sun, and she was rude to me, and she's 13 and I'm a grown woman. And yes, there is that part in me that goes, she should show me more respect. But that word should is an interesting word. And I tell caregivers I work with all the time, you gotta just eliminate it from your vocabulary. But what I can do is show her grace and teach her that you can talk to me like this all day long, and I'm not going anywhere.
And you're showing that child so much about who God is, about who Jesus is, by not giving up and saying, this is hard, you're being difficult, I'm done, because it should not be like this. Yeah. And it really puts us in a place of having to be very intentional about my view of success or failure. I cannot say that was a hard encounter, so I failed, or I'm not doing anything. And I also really need to understand that I cannot just look at the surface of what's happening.
Yeah.
This is a situation where I have got to realize that what I'm seeing is not a clear definition of, is this a good or bad job I'm doing?
Yeah.
That really zeroes in on this process of redefining a few of our views of things. This whole process really makes me dig deep into intentional empathy and intentional sympathy, and to always remember. And this takes a lot of intentionality because I have to remind myself constantly of this, that what might not be okay at least makes sense. What happens inside of me when I am in this situation and I can accept the fact that something at least makes sense?
And that question kind of sums up why I think it's helpful to go beyond the diagnosis, okay? That's why I say special needs isn't just what we can diagnose or see a doctor about or medicate, you know? It's about recognizing that everybody has some times, and every single child you encounter, an adult too, they are going through times in their lives sometimes where they could use a little extra special individualized care. If you're not comfortable with saying that all these other things are included in the special needs umbrella, okay, call it whatever helps you tap into your compassion. These are kids who need more love, they need more patience, and every kid will go through a time when they need this from us. So it's super important for us to just be aware of that, and it doesn't change the fact that we go, this behavior is unacceptable. Was that young lady's behavior unacceptable almost the entire week we spent together? Of course. I believe that children should respect adults and show them respect and follow instructions. I believe that, but the fact is my belief didn't change her behavior. And so even though we still want to address those things and we want to be teaching all the time more acceptable ways of behaving, we also have to, I think by tapping into that compassion in ourselves, by realizing there's a reason for this behavior. The behavior's not okay, but the reason makes sense. It allows us to take a step back and recognize that this child is needing love, rather than just reacting based on you're being disrespectful, which is our knee-jerk reaction. But it just allows us to be a little more patient, a little more full of grace.
Absolutely. So I grew up being taught that I should treat a child who has special needs just like I treat everybody else. How do we balance that idea with just the fact that a child who has special needs, whatever that special need may be, needs special attention, special response out of me? How do I balance those two things?
So that's a fair question. And I think a lot of times we get bogged down in that. Like, if we're looking at individualized care, then how is that equal? How is that fair for everyone else? And the fact is, I'm not really a believer that by offering a little bit of assistance or support to someone who needs it is somehow mutually exclusive with treating them as equals to their peers. It's just recognizing that they're capable of everything their peers are. They're capable of it. They just might need a little extra help to get there, or a little extra time to learn that skill. Everybody on this planet is better at some things than somebody else.
Sure.
Everybody has different skill levels on different skill sets. We recognize that. We need to learn to identify that in the kiddos and figure out, how do we help? I think a big part of it is, I think sometimes we get bogged down, especially when I'm talking to teachers in school systems, and this goes for teachers here at church too. You know, you're trying to make sure everybody's getting the education that they deserve. But if we've got to spend a lot of time helping so-and-so, then we feel like we might be neglecting our other friends. And I totally get that. But one of the most important things we can do is by giving assistance and giving a little extra special attention to our friend who really, really needs it in order to be able to participate, and then being super intentional about praising other kids in the room. I can be sitting here and helping you, but also saying, I love how you're working independently, right? I can draw attention to everybody. I can make sure everybody's getting what they need. And then also what I'm doing by doing that is I'm encouraging these peers who are already excelling at the skill of working independently, or whatever it may be. I can encourage them to celebrate the success of my friend who needs a little extra help, but still got there eventually, right? So we're teaching them that life isn't always about constantly getting the exact same number of pats on the back that my friend over there got, right? We don't really want to raise up kids who feel that they deserve exactly the same thing that everybody else got,
Yeah.
right? We don't want to teach them that, like, just because I'm giving him a little extra help, you're somehow being deprived of something. We want to teach them to lift up their friends who are needing extra help and then getting praise for lifting someone up, because we love that. We want to see more of that.
Absolutely. Okay, all said and done, give me a few nuggets, a few practical ways that I can help a child who is having trouble in these areas. Give me some items in my arsenal that I can bring out to help a child join in
Yeah.
effectively.
So again, we want to recognize that each child's an individual, and there's not going to be a one-size-fits-all solution to any given behavior issue, or let's just say a kid who's struggling to participate, however that might look for them. So we want to consider the individual situation and what's going to work best for that child. And it may be a little bit of trial and error initially. So we want to consider things like, are breaks acceptable for kids who may need them? For instance, if we've got kiddos who, we discussed earlier, breaks in terms of kids who have some sensory issues that may need breaks from bright lights, loud noises, overstimulating situations, and that's fine. But what about kiddos who have hyperactivity? What about that? Do they get to take a break for a minute? I would argue that sometimes that 1 to 2 minute break in the hallway where you allow them to just do some jumping jacks or spin in circles, whatever they need to do, and then come back to class, you're most likely going to get more productive work out of them after that 1 to 2 minute break than if they're forced to sit. You're going to wind up spending most of the class trying to get them to be still, whereas if we allow them, I call them wiggle breaks, which that may be kind of silly for some of the older kids, call them what you need to call them, but
Get the wiggles out.
if you allow that, you're more likely to get a lot more productive stuff out of them. So we have to think about risk versus reward. A 1 minute break, we can live with that, rather than 20 minutes of trying to get them to
Sure.
sit still and participate. Some kids, it's possible, and I know sometimes this requires extra manpower, so it kind of depends on how many volunteers you have available, but some kids may honestly need an adult buddy. We see that in school systems all the time. There are kids who need one-on-one aids initially. Now, usually the goal in a school system is to eventually fade out that one-on-one assistance. Hopefully that child is going to learn to be able to function in the classroom without that buddy. And that's absolute, I think that should definitely be the goal here too. But some kids are not ready to do church the way we need them to do church and need basically constant somebody on them to remind them, this is what you're supposed to be doing. Now we do this. And that may feel frustrating, but again, we just have to consider, don't think of it as a behavior problem, think of it as a skill deficit. That child does not yet have that skill to participate in church the way we'd like for them to,
Right.
so they may need a little extra attention up front. Also, peer buddies are a great thing. I love peer buddies because if you've got a kiddo who's really not responding well to redirection from adults, and that happens, they may feel kind of embarrassed or called out in front of their friends, they might respond better to encouragement from a peer. However, we don't want to just pair up the one kid who's having issues, because that still sets him apart, right? So instead, we pair up everybody in the room. That way, if I've just told you to turn to a Bible verse, and I see my friend over here isn't following that instruction, all you have to say is, everybody check your buddies, make sure they're doing what they're supposed to. Super easy way for them to check in with each other. It allows them to celebrate each other's successes. Again, something I think we can always encourage. And it also allows you to correct a child without actually having to correct them and draw attention to their behavior.
And you might even build a friendship out of that.
Absolutely.
That kid has one more way of feeling like everybody else, and included.
Exactly. And honestly, you want to consider personalities when you're doing buddies. When you're pairing up buddies, we don't necessarily want to just go by who you're sitting next to. Sometimes it's helpful to be a little more intentional than that when you're pairing up buddies, because certain personalities, it sometimes is really easy to go, well, this kiddo is really loud and hyperactive and not doing what I'm asking them to, but this kiddo's really well behaved. But let's examine what's going on. Is this kiddo really, really quiet and shy and absolutely follows the rules? That's wonderful. However, this child might get kind of steamrolled by that bigger personality and have a hard time speaking up to encourage them. Sometimes pairing up two kiddos who both are a little bit hyperactive and loud, they can actually help check in with each other and keep each other mellow. You just have to use your judgment, really.
And I've seen multiple situations where that kid who might be otherwise, hyperactive, but not, diagnosed as such, they may come alive if they have that mission, and I am now able to pour myself into somebody else. That kid is it also has a great effect on him or her.
Yeah. Well, and it can help build self-esteem. You're giving them a responsibility. You're giving them a job. I'm responsible for helping my friend. And sometimes that's the kind of encouragement that kids need. And kind of going off of that, there may be some kids who genuinely do not have the skill yet to sit through an entire hour of class or an entire hour of church. As much as we would like for them to do that, they just don't have that skill yet. And this is actually something I read about in the books that I discussed in our first training. They're both about leading special needs ministries. And one of the things some of the churches they were looking at has resorted to, they've looked at kids who are like, they can make it through the first 20 minutes of class, and then it's just sort of downhill from there, just a disaster. They're just not there yet where they can sit the entire time, and it's so disruptive to everyone else, and it's also kind of disheartening for that child who's getting reprimanded the entire time. So what they've started doing is saying, okay, so you participate in the first 20 minutes of class, and then for the rest, we're going to have you go and help so-and-so make copies of things, or maybe they clean up the auditorium. I have to go look for papers in the auditorium, or maybe they help with cleanup from a meal if there's been a meal. They give them a job. They teach them to be servants, because if you're not able to sit and participate in the lesson, well, we can still teach you something, and you can be helpful. You can serve a role that needs to be served, and man, that's a pretty cool lesson for them to learn too.
It's our goal is that they learn and they grow, and so that might take a different form and might manifest itself in different ways on different kids.
Absolutely.
So let's end on this though. Let's after talking a lot about the needs and care of the kids, the reality of it is, as volunteers, we hit those moments where these things are just, it's not going like I think it should, like I want it to go. And even as I do my best to apply all of this, I'm going to hit those moments where I get really frustrated. What are some things when I feel my blood pressure going up and I feel overwhelmed? What are some things that I can do to help me get through that?
Yeah, that's a good question. Something we talk about a lot in the mental health field is self-care. And the reason we talk about it so much is because when you're doing your best to help others and you're pouring yourself into others, you can drain yourself so easily to the point where you are no longer helpful. You're not able to deliver the help that you need to be to the people who need you most. So I think self-care is something volunteers here need to be talking about, and something that's it's an ongoing process. But some of the things we have to realize is, you've got to learn to recognize signs of anger and frustration in yourself. Recognize when you're going that direction. Check in with your body. Recognize your body language. How loud am I talking right now? Am I raising my voice? Am I rolling my eyes? Am I, all of these signals that we give off to the kids that show them like, oh, she's mad, or whoever it may be. Those are also things we need to be aware of and go, oh, I might need to take a walk. And I literally mean take a walk. If there's a behavior happening and you feel in your heart of hearts, You check in with your body and you go, I'm not ready to handle this calmly. I'm not going to be able to have a calm conversation about this unless they're doing something so dangerous that somebody's about to get hurt. Walk away. We'll either let another adult handle it or leave it for a minute and come back. That's not the end of the world. It's much better to take a break, go out in the hall, get a drink of water, take a bathroom break, maybe do some stretches. I don't know, whatever you need to do to just like calm yourself down a little bit. Then go back and try to handle it, because that's always going to be better than handling it while angry. If you're not calm, you're not thinking straight, and you won't handle the behavior situation as ideally as you could. I also think, it's extremely helpful for volunteers to talk to each other.
Yeah.
Like that's a thing. Again, mental health professionals, we do this. I know teachers do, everybody, you talk to colleagues because you need to be able to vent frustration sometimes. Burnout can happen so easily where you find yourself getting so wrapped up in the stresses and frustrations that you are stressed from the moment you walk through the doors and you stay angry, and then eventually you just burn out to where you can't do it anymore. So by allowing yourself a private one-on-one conversation, I say that because obviously we don't want to talk about these things in front of the kids or really even in front of other people, because that's not their business, and we don't want to be talking about kids, especially by name, to other people, right? But acknowledging that, like, wow, this day was hard. I do that. I have a friend who does the same kind of job I do. And some days I just have to call her, and without using names or anything, I just tell her, there was a kid and this happened, and just allowing myself to get that out of my system. And the fact is, I still love that kiddo, but we had a bad day and it was hard and I need to talk about it. But the real key when it comes to venting is make sure it's venting and not ranting. It's so easy for it to become ranting, which actually can contribute to burnout. It has the opposite effect. If we find ourselves consistently ranting about the same child over and over again, or the same situation over and over again, and never really coming out with a positive conclusion at the end of that conversation, it's probably going to be counterproductive, and it's actually only going to make you feel worse about that one child or that one situation. Your attitude will not improve at all. So volunteers, keep each other accountable. The biggest thing is, if you're going to have one of those private one-on-one conversations and allow some venting to happen, allow that. Empathize with it, say, oh my goodness, that is so frustrating. But then also make sure that you guys talk about, okay, do we need to pray about it? Do I have some ideas of how that might help? Or, hey, why don't you grab me next time he's doing that? Let me see if I can help, Just try to come to some kind of positive conclusion, offer some kind of constructive advice so that the end of the conversation kind of ends on a happier note and you can get back in there and do what you need to do.
Absolutely. Well, you've given us a lot to take in, a lot of information, and a lot of encouraging us to redefine a few things in ourselves. One of the biggest things that I see all throughout all of this is this idea that basically I'm just treating these children with more understanding, more patience, more love. The fact is, I can apply this to any kid. The fact is, broader than that, these are things that I need to apply to everybody that I encounter in my life, of any age, in any situation, but especially the kids that I am called to reach, even if it's just for a few minutes every week. This is just how to treat people. I am going to add these handy little titles under each topic so that we can refer back to this video, jump ahead to a scene, and reacquaint ourselves with all these very, very helpful ideas. Thank you, Kirby. If anybody has any questions, please don't hesitate to ask me, and I'll ask her. Or you can email her at...
It's Kirby E. Fitz, that's F-I-T-Z, at gmail.com.
Kirby E. Fitz,
That's
F-I-T-Z, at gmail.com.
That's right.
We will be releasing another video soon about incentivizing and buddying and very positive versions of discipline, and that'll be soon. But please watch this video as many times as you need. Refer back to it a lot of amazing information here. Thank you, Kirby,
Thank
and
you.
we will see you guys next time. And cut.